really, we are grateful to you that your cooperation, your inspiration, your overwhelming support has inspired and motivated us to continue the journey to infinite aim. Thank you. Today, we would like to welcome you all at our milestone of 2070. Thank you. This is our 62nd webinar of this month, 66th webinar of this month, and 830th webinar in 365 days due to overwhelming response from your side. For this series on infertility, we would like to congratulate Dr. Kamini Dhimanji for her mentorship, her guidance and coordination. Thank you. Thank you very much, Dr. Kamini Dhimanji. And would like to welcome Dr. Ashokan Vasudevan, Professor and HOD, Department of Prasuti Tantra, NCT Ayurvedic College, Amreli, as the keynote speaker of the day on the topic General Management of Female Infertility. Thank you. Thank you very much for joining. Please do join every day. So I would, without wasting much time, I would like to welcome Kamini ji and invite her for her blessings.
Namaskar, Pavanji, Nishanji, Ramveer sir, all the participants and Dr. Ashokan. We have discussed last week how to approach the case of infertility. In that continuation of approach, now we will discuss today general management, and then in consecutive episodes we will discuss the specific management of specific disorder or causative factor. We will start today onwards with how to approach and how to start the general management, and what can be the basic principles of the treatment of the case of infertility. So I would like to invite Dr. Ashokan. Over to you, Dr. Ashokan. We will take up the question after the presentation.
Namaste, madam. Respected madam, Kamini Dhiman madam, and all the office bearers of AYUSH SAMRIDDHI, and Pavan Kumar ji, and respected senior professors in the group, and all the other participants. Today we will be going through the topic of general principles of management of female infertility. So for this purpose, shall I share my screen?
Yeah, yes, sure. Yeah, visible.
It's thank you. And as we all know what is infertility. It's according to modern contemporary sciences, it is the failure to conceive within or more years of 1 or more years of regular unprotected coitus. And we know basically for the understanding of general principles of treatment, we should know what is primary infertility and what is secondary infertility. As we all know, primary infertility means those patients who have never conceived, and secondary infertility indicates previous pregnancy but failure to conceive subsequently, irrespective of the cause and duration of marital life. Then in Ayurveda, we are knowing that Kashyapa Acharya has very correctly mentioned that by Sahaja or by Prakrita Avastha, if the couples are able to conceive, that is they are Taudhanyo, they are the blessed one. If not, they are to be Vishajitabhyo, that is Bheshaja Prayoga is essential. So maybe Dravya Bhuta or Adravya Bhuta. So Bheshaja is we have to consider both. Then the Vandhyatva is the term used in Ayurveda for denoting the fertility issues. And Ayurveda has mentioned, though the Karanas of Vandhyatva, Bheda of Vandhyatva, etc., Ayurveda has various places in scattered references. It has mentioned the causative factors for fertility. So wherever the Prakrita Avastha is deviated, Ato Anyata Vikritihi. So that the word is to be taken here also in this context of infertility management. So what are the fertility promoting measures have been told? Causes for pregnancy or conception and garbha sambhava samagris are mentioned. So wherever there is a controversy to that or contrary to that, hindrances to that, that will lead to Vandhyatva. So Vandhyatva is in Ayurveda, which is very specifically related to female infertility, whereas Purusha Vandhyatva or the male factors of infertility are dealt as Shandyakara bhavas, or the word Vandhya is also used there, Vandhya, Puti Praja, Klina Praja, etc. Though it is mentioned Trinaputrika, the three types of Bija Dosha Janya fertility disorders in male are described due to Bija Bhaga Avayava and Purusha Karanam Bhavanam Chadushtihi. So the first two are related to the autosomal, that the third one is related to sexual sex chromosome, involvement of the sex chromosomes too. So when compared to that, the Purusha Vandhyatva is more related to be the Shandata Karanas, or the Klibatva. The Charakacharya has mentioned in detail about a Klibata, whereas the Napumsakakara bhavas are mentioned variedly by two acharyas, whereas Sushruta Acharya has elaborately told as Sashukrastu Amijnaya Ashukrau Shanda Samyako. So the whatever the variations in the psychosexual behavioral pattern, which in the present scenario in the world, all over in the world we are seeing, is more or less pointing towards the well-known documentation of Acharya Sushruta, where he is mentioning it as Asekya, Saugandhika, etc. types of Napumsakata, and Shandata as absolute sterility. So with this background of Vandyatva term, it is referring more or less to the female infertility. We are going ahead with the classification of Stri Vandyatva as per Acharya Charaka in the Sharirasthana second chapter, that is Atulya Gotrodbhava. So Atulya Gotriya Sharira, wherein he is elaborating about the positive factor for pregnancy, the timely delivery and onset of labor, etc. Very nicely, even which is applicable now to today's society. So Sapraja and Apraja are the one of such classification mentioned by Acharya Charaka for Vandhyatva, wherein Sapraja and Apraja we will be seeing what it is. Then Harita has classified Vandhya as Shat Prakarena, where he is mentioning Kaka Vandhya as one child sterility. As we know, Kaka is a model bird for us because it is depicting so many things in life. Because whenever we are considering the Aya Pramana of a construction of a building or a house or a room in a house, we are taking Gajaya and we are taking Dhvajaya, etc. At the same time, Kaka is also, that is the construction of the nest. You can see the nest of the Kaka in that with one single child over there. So it is one child sterility is mentioned in our context, but the Aya Pramana of the building of the Kaka of its nest is very particular. It builds the nest in the same Aya. Dvajaya is the Aya which is mentioned for human house as well as for temples, building of the temples, whereas Gajaya is mentioned for a room construction or a house construction for human beings only, whereas Simhaya is another type of measurement which is mentioned, or Hasti Pramana, or the in olden days the measurement was not in meters and centimeters and square meters, it was in Hasta Pramana or in the Gaja Pramana. सो कितना गज है भूमि है तो पूछे पूछे तो कितना गज है पूछते थे, तो अभी तो गज का प्रमाण ही भूल गए हैं हम. फिर काकबंध्या is one child sterility because it delivers one child and subsequently only one child will be delivered. So in case of kakabandhyatva, the woman will not subsequently conceive, whereas the approach of treatment for a kakabandhya will be different from that of anapatyavandhya. That is why we should know the classification. Then anapatya is a primary infertility where there is a primary failure to conceive. Then Garbhasravi is more or less found in Putragni or Jatakni Yonivapat, wherein we have to consider why this is to be known is it is Dushta Arthavodbhava. So Arthava Dushti is or underlying factors which does the Arthava Dushti are also the classic causative factors for Garbhasrava, despite the factor that the Shukra Dushti is also one of the hindering factors which is not much a time dealt with in case of female infertility, leading to Garbhasravi Vandhya. Because in Shukra Gatavata Lakshan it is mentioned as Kshipram munchati badnati shukram garbham adhapiva. Kshipram munchati garbham. So badnati garbham in the abnormal delivery or obstructed labor, as well as Kshipram munchati precipitate labor, or else premature labor contraction, or else garbham sravati patati prasravatyapi shukram hi dushtam. So sadaram bhagate naram acharya charaka. So, wherein Garbhasravi Vandyatva, both the partners are equally responsible, and Putragni and Jatagni is also one of the causative factor. So, Yoni Vyapat Chikitsa is also one of the Chikitsa Sutra applicable in case of the infertility or subfertility. Because all the Yoni Vyapat Upadrava, if we analyze, we will come to know that न शुक्रं प्रतीक्षति नाथ शुक्रं प्रतीक्षति ततो गर्भं न गृह्णाति स्त्रीगच्छत्यामयान् बहुन्. So this is the outcome, ultimate upadrava of all the yoni vapats commonly mentioned by Acharya Charaka and Bhagavata is that shukram na atha pratīcchati. Shukra grahana. So whereas in sadhyo grihita garbhaya lakshanam shukra shonitayo ravabandha they have mentioned contradictory to that, that is sadhyo grihita garbhaya lakshanam, fertility promoting factor. So that is mentioned as a lakshana there. Then balakshaya, as of sharirika, manasika, reproductive tract. So any of these may lead to the balahani or balakshaya as a causative factor for vandyatva. Garbha koshasya bhangatva. So ardhavaha sroto viddha lakshana, so also leads to vandyatva. And precedentia may also be one of the factors, because I have come across one single patient so far in my treatment period. Only one patient I have seen, aged 31 years, visiting the OPD with primary infertility. When we were eliciting, we asked what is the parity. We were asking about parity. She told, I have not conceived yet. So we were astonished to find that she is having precedentia leading to infertility. So the Mritavatsa is another condition where recurrent pregnancy loss is found, and intrauterine death or Jataharini may be associated condition behind this Mritavatsatva. So various causative factors are told in addition to these six classification. If we consider some of the medico-astrological aspects of infertility, we will get that is Vandhyatva. Various causes have been mentioned in Jyotisha Granthas, especially if we want an Brihad Jataka is one of the fundamental books, wherein the normalcy of Artava Chakra is mentioned as Kujendu Hetu Pratimasa Martavam. So Kuja and Indu, that is Bhumi Sutta, that is Dhara Sutta, is Kuja or Mangala, and Mangala is representative of blood in the human body, whereas Chandra is the Indu or Shitakaraha, Shitagu is a synonymous. So he is responsible for all the hormonal variations as well as water body in the Sharira. So whenever there is a lunar up tide and low tide or neap tide, there are alterations in the hormonal variation, and this definitely affects, because in olden days the Ayurveda Shastra as well as the Kama Shastra used the knowledge of Chandra and its kala in the Sharira, right hand side and left hand side of the body. So half they divided it into Ardhanarishwara Tattva, and they divided the Kama Kala Bhaga as well as Chandra Kala Bhaga. So basing on which the fertility promoting effect, and the woman was free, the woman who had the knowledge of this Kala, she was free to decide whether to conceive or not to conceive by Bhartra Samagama. So this was the capacity and the knowledge of Kama Shastra in the field of Indian culture. Then coming to the Hetu, so Kujendra Hetu is one of the Hetu for normalcy of menstruation. Whenever the Kuja and Indu bhavas are abnormal in a female chart, there will be alternatively irregularity of the menstrual cycle, which may or may not be associated with anovulation. So this is one of the fact. Whereas other factors like infertility, they are mentioning the Buddha Shani Yuti is one of the factor wherein there will be manifestation of frigidity or subfertility. And one of the other causative factor is mentioned as the Dushti of Shukra in the female chart as well as the male chart. Then the fourth factor which is mainly mentioned is the presence and positions and power or bala, shat bala of, we say, cheshta bala, sthana bala, dig bala, etc. of grahas, and the vayavastha bheda in as per the horoscopical position of the person, the position of the planets depicted at the time of birth of a person's chart, we can assess the bala of the Guru Graha, that is Jupiter, which is at most important because it is said to be Daiva Bala. So in Ayurveda also we say the uh, the Purushakara and Daiva as a causative factor of the disease, when other causative factors which we are tracing at physical level or our metaphysical level, when we are tracing the causative factors, we are unable to find any attributable cause, we say it is Daiva. So karma yat paurodahikam adrishta hetutve sati hetutvam. So these are the two commentaries mentioned in Charaka Samhitas, wherein they are mentioning the explanation for Daiva Shabda. Then, so Daiva here, it is also the Daiva Bala is mentioned for Jupiter, and he is said to be the Santana Karaka Hetu. So whenever there is a hindrance or untoward positioning by Gochara, Gochara is the transit, Nija Jataka is the time of birth chart. So when in Gochara at present time, for example, Guru is positioned in Vrishabha Rashi, Mesha Vrishabha, Dvitiya Rashi, which is depicting the Kantha Bhaga of the Kala Purusha. So Kala Chakra Ganana as well as Kala Purusha Ganana in our daily horoscope, if we see that particular position, neck and face, is the position of the Guru now. So at that time, what are the happenings and non-happenings in accordance with the Dwadasha Rashi and Bhava of a person's birth chart. In his birth chart, if the Guru is in second house, or he is in the fifth house, or he is in the Lagna Bhava, he is in the seventh house, ninth house, in 11th house, it will be favorable for that particular person at time of conception. If it is in contrary to that, he is in third house, he is in sixth house, he is in 12th house, or he is in eighth house, it will not be favorable for conception. So Guru Bala is also to be elicited in a horoscopical way. So that is very significant as a causative factor. Then when we know these are the causative factor, Buddha, Shani, Yuti, or some other factors, we can avoid those time period for conception. So that was a selectivity of previous days. When we knew that when we match the horoscopes, we don't match the husband and wife compatibility only. We see whether they will live long. Ayu is a pramana for everything to begin with. Subsequently, we look into their ability to conjugate and reproduce a next lineage, which will be very healthy. So that is the next thing which is observed, and their longevity followed by their reproductive capacity and their financial and their occupational things. These are some of the matches which are seen, despite the things that nowadays it has become a just as a formality. Then Hetu. Coming to the Hetu, we know that female causes of infertility are 40 to 55%. Ovulatory dysfunction is 30 to 40% of the cases. Tubal diseases, uterine factors. When we know the weightage of each causative factor, the patient even may come with cervical factors of infertility, cervical mucosal hostility for the penetration as well as the mobility, which arrests the motility of the sperms, or anti-sperm antibodies are produced, or autoimmune diseases are producing some factors, or pinhole os or anatomical factors are the causative factors in cervical. So it may be a minor factor, but our patient got these factors as a cause, then our management principle should vary accordingly. So the first and foremost thing is assessing the hetu is tracing the history properly. So history taking is very neglected part, and clinical diagnosis is the least bothered thing, because the clinical diagnosis, the patient doesn't want to say, we don't want to ask, we go through the investigation reports and we land up in some we have some prejudiced in our mind, so that we think that this is the diagnosis, which is the condition the patient is a diagnosed case of. So don't take it as a diagnosed case. You diagnose the case in your way. You diagnose the dream diagnosis of the patients. What are the dreams which they go through? Whether they are flying in the air, whether they are looking into the fire and tejogola in their dreams, whether they are traveling in the water or swimming in the water often in their dreams. So these things are to be differentiated to get into a particular. For example, if you ask pregnant woman, definitely they will have doshajam and bhavikam. So both types of and other types of the swapnas also in pregnant woman. So these are depicting the outcome of pregnancy too. Then unexplained factors may also be found in 10% of the cases. So other causative factors which are mentioned in our Samhitas are, so coitus with a woman who is very young, very old, chronically ill. So all these, when we know that these are causative factors, with humpback we need not say humpback only, or lateral posture, it is all postural related. So all the postural related can be modified while counseling a patient for infertility treatment. This is the proper posture for conception. So this should be informed to the patient that this is the fertility window and this is the posture for conception. So for example, a patient coming to us with a complaint of mild retroflexion of the uterus or retroversion of the uterus or mobile retroversion of the uterus, this postural variation can invariably help the patient, or some Setu Bandhasana if it is advised repeatedly to be done by the patient with Kegel's exercise or Mula Bandha or Ashwini Mudra. So this is going to definitely help the patient in conception even with a single or two sittings, or in a month period or two the patient may come back with a happy news. Then semen falling over the Samirana Nadi or the outermost part of the yoni are factors which fail to impregnate the woman. So that may be related to the postural as well as the knowledge about the conjugation. Then Garbhasambhava Samagris are mentioned as Rutu, Kshetra, Ambu, and Bija. And Matrajati Bhavas are also significant. Age for marriage for conception and causes for delay in conception are also mentioned in Ayurveda. These are the measures for reversal of the fertility. So the treatment and the basic approach should be Rutu, how to correct the Rutu, what is Rutu, and how to correct Rutu. All these factors, cause it as causative factors we have seen in the previous presentation. Now we will be looking into all, we know what, how to correct Rutu, how to correct the Kshetra, so how to correct the Ambu. So more or less these three are interrelated to uterine factors. So the correcting the factors of, if there is no anatomical problems for a Kshetra, Kshatat Trayate iti Kshetraha. When we consider the Kshetra, the other Nirukti of Kshetram Garbhashayam in Ayurveda, other Shastra, Anya Shastra, if we assess, if it is protecting us from the untowards happening in our life, either physical or mental or psychological, the psychosomatic. So these things are to be considered. So we have to consider the Rasa Dhatu and Uttarottara Dhatus as first three essential factors. Whereas Bija is the Saptama Dhatu in case of a Purusha and Stri, because in Stri also Kashyapacharya has very well told, Tasam api balam shukram pushtim balam pushtim chakaroti. So in them there is bala and pushti is a manifestation of Shukra Dhatu. Then Matrajadi Bhavas are mentioned. So if there is any hindrance to those things, that may depict epigenetic aspect of the infertility factors, which we can overrule by proper knowledge and applying our Siddhanta and Chikitsa Sutra. Then age for marriage, definitely we can come over this problem. So tato न्यूनाब्दयोः पुनः रोगी अल्पाय रधन्यो वा गर्भो भवति नैव वा गर्भो भवति नैव वा भवति. There may be conception with adhanya garbha, that is a non-thriving pregnancy. So the pregnancy or the child, if it is born, may not thrive in society. So it is not suitable to conceive such a non-longevity, the child without a longevity. Then the naivava bhavati, there is a possibility of non-conception. So these are age for marriage. So cause for delay in conception is very well depicted. The Putram Chirat Vindati Saprajapi. So there Charakacharya is mentioning very elaborately that Putram Chirat Vindati Saprajapi. Even though she is fertile, she may conceive with difficulty or delay in conception, as in Yoni Pradoshat Manasobitapa Shukra Asrad Atma Ashaya Kala Dosha. Akala Yoga Balasamkshayacha Garbham Chirat Vindati Saprajapi. I will be back in just a minute. Sorry for the disturbance. Sorry for the interruption. Then the ovarian factors, which include bija, that is anovulation or oligo-ovulation as in PCOS, luteal phase defect as in hypothalamic pituitary ovarian dysfunction and decreased ovarian reserve, endocrinal or drug-induced endocrinal like thyroid dysfunction or hyperprolactinemia. Then tubal factors of infertility, which are usually we have to go through Kshetra Dushtis, wherein we will be coming across various Uttarabasti like modules, intervention modules, which are required. Even nowadays, the commonest thing which we come across is the tubal ligation. So tubal recanalization the patient gets done and comes to us for treatment of IVF or preparation for IVF. So when we get such patients, we have to go with the Shodhanottara Shamana along with the Uttarabasti repeatedly. So this is the treatment variation in case of tubal recanalization and the post-surgical Ayurvedic intervention for achieving fertility, which is due to tubal factor. Then pelvic adhesions or tubal obstruction as in PID has to be managed accordingly. Then damage to the cilia, so which is just a irreversible phenomenon, but we can try for the Thaila Uttarabasti. Then tubal dysfunction, altered tubal motility, that is Anila Ashuddhi and Apanavata Dushti, we have to consider for Apanavata Anulomana. So these are some of the modalities of intervention which may be required in these factors. Then uterine factors like Ritu, Kshetra and Ambu combinedly if we take or one by one. Inadequate secretory endometrium and endometrial factors as in Vamini. So Shadaha Supra Saptaragarbha, maybe early the expulsion of the Savata Mudgire Bijam. Savata Mudgire Bijam Vamini Rajasayutam. So early expulsion of the concepted material or early embryonic phase. So the morula phase maybe. So then Asherman syndrome, D&C, recurrent D&Cs or interventions which has already been carried out knowingly, unknowingly by self medication or by usage of some abortifacient agents by themselves. Then submucosal fibroids like Granthi or Arbuda Vikaras, which may be a Mamsa Pradoshaja Vikara. So Mamsa Pradoshaja Vikaras are also to be, so the line of treatment then Shastra Kshara Agni Karmacha and Kshara Pana, Kshara Pani Kshara as well as the Pratisarana in the form of Uttarabasti, Taila along with the Kshariya Dravyas. Then the Granthi Chikitsa and Gulma Chikitsa may also be required in some of the conditions. So endometritis, as in though it is not exactly the paripluta, we have to incorporate pitta lakshana, because of which we have to incorporate it under the concept of endometritis. Then congenital malformations of the uterus, then it is bija doshaja, wherein I have seen one of the gynecologists known to me, surgeon by practice of gynecology. Both husband and wife are gynecologists, not Ayurveda, MBBS, and they didn't had a child. They went for tubal the septum resection, uterine septal resection followed by IVF, and they conceived. First was female, second one was male. So that subsequent pregnancy also she achieved by IVF, and they continued the pregnancy. So this was then when it initially came to us. I told until and unless the surgical intervention is done, even after surgical intervention, it is a very difficulty for concern. Then the gynecologist surgeon told that we have achieved it. So they have done all the procedures. So no much Ayurvedic procedures they followed, only oral medication of Ayurveda. Rest of it was surgical intervention and hormonal therapy, and IVF was followed. So this is one of the even congenital malformations. When we say septate uterus, we may have a success rate in contemporary sciences. We have to keep our mind open for supportive therapy or adjuvant therapies through Ayurveda. So IVF is such a field wherein uterine factors of endometrial factors of infertility can be corrected more by Ayurveda than through modern interventions of hormonal therapy. Even ovulation induction medicine is one of the field where Ayurveda can work better than the contemporary sciences. So instead of giving clomiphene citrate or the other injectables for ovulation induction, we can go with Ayurvedic modality of intervention of oral drugs. For example, Ashwagandha Kshirapaka, because of the Saraguna in the Ashwagandha, when it is added with the kshira, and though it is tikta and Rasarakta Vishodhaka, it is acting very effectively in ovulation, Visarpana Shila. So the Visarpana Shila of Shukra and Artava is very well mentioned in the classics. So Visarpatyartavam Tatha Pumsam Samagami has been mentioned. So similarly, the Ashwagandha is having a role there. So these things are to be the Visarpana Shilata here. It is about the traveling or the migration of the ovum as well as the sperms and fertilization. So these things are to be very documented evidences that are to be considered. And Ayurvedic like the Pichudharana, so is highly found to be effective in the management of the endometrial factors of infertility. So that is one of the evidence based. I will go through that evidence in the end of this presentation. The yoni pichodharana was found to be highly beneficial in endometrial factor of infertility. Then cervical factors, that is marga ashuddhi, so may lead to cervical, like a cervical stenosis, may need surgical intervention or progressive dilatation. Then antisperm antibodies by oral medication, which is having action on the balapramana or shleshma dhatu in the sharira, as well as that is which is affecting the overall physiological process. Then pinhole os or suchimukhi yoni vapat may require a surgical intervention. Antarmukhi os away from the seminal pool. So as in aticharana, we are mentioning saiva aticharana is one condition, whereas the other type of aticharana, as mentioned, purushat purvam atirichyate. So attainment of orgasm prior to that of the male. So that is also said to be one of the causative factor for infertility. So or orgasmic dysfunction. Then congenital elongation of the cervix, second degree uterine collapse, scanty mucus leading to failure of the spermatozoa to move further, and chronic cervicitis. So even patient, I have seen one woman who was around, I think, 40 days of pregnancy, 35 to 40 days of pregnancy. She came to us with severe lower abdominal pain. When we are not supposed, the UPT was done, she was having infertilities in 16 years. And she had a white discharge PV and severe lower abdominal pain, burning micturition. So we did a UPT. UPT was positive. So we came to know that she is pregnant. But even after knowing that she is pregnant, though it is a Shastra Viruddha, I did a PS finding. And on PS finding, the cervix was it was like a red rose. So it was so much of inflammation and neovascularization was seen on the cervix, and it was so tender. So the patient had highly tender cervix, and cervicitis was the observation. She had cervicitis and she has conceived. So this was the condition, and usually this cervicitis will lead to tubal infections also, in case many a times if the sperms are ascending with the cervical infection. So the infection may be carried on to the ascending organs. That is the postulation in contemporary sciences. But we did a pichudharana, though pichudharana and prakshalana is contraindicated in pregnancy. We did prakshalana with the panchavalkala kvata, though it is shastra viruddha, and in pregnancy period, as it is in a pregnancy period. And we also did one pichudharana with a phalasarpi, which is indicated for continuation of pregnancy. Though pichudharana with phalasarpi is not indicated in pregnancy, we were forced to do it in order to continue the pregnancy. So this was the condition, and she continued the pregnancy. That was another factor of it. And 16 years of infertility, spontaneous conception. Then vaginal factors: atresia of the vagina, transverse vaginal septum, septate vagina, and vulvovaginitis are some of the vaginal factors which will lead to subfertility or infertility. So these are to be considered, and they have to be treated in advance before attempting the patient for taking the patient for Uttarabasti, that is intrauterine instillation of medication. Then other factors which include dyspareunia or poor coital function. So many a times, unless until it is elicited, dyspareunia will not be revealed by any of the couple. Male partner may also have dyspareunia. So this will not be revealed until the elicitation is done by verbal conversation or couple counseling as well as the separate counseling. That is, they have to be kept together, and then have to kept separate and questioned, and again they have to be brought together to overcome the confusions. Then abnormal peritoneal fluid, then increased sperm phagocytosis by macrophages, then fertilization and implantation failures, maybe because of the fertilized zygote or early embryonic phase defects, or maybe because of the implantation site defects. So that is also possible. That is, poor endometrium or residualization is not happening properly. Then the third one is subchorionic bleeds. So I had a case study which I had presented earlier once on some occasion. I forgot to add it here for evidence based. The patient is none other than one of the Shalakya postgraduate scholar who was known to me. She was working in Varanasi, and she's still working in Varanasi. So she had conceived, and she had subchorion bleed, and she was advised by the Ayurvedic fraternity that to take progesterone pills or such the other medication which are standard medication. But she had some feeling of warmth and some other embarrassment after taking these pills. So she contacted over telephone and requested for Ayurvedic treatment. The treatment adopted was subchorion bleed was the diagnosis already known. So Rakta Pitta Karayarnarya Raktam Pittena Doshitam Ati Pravartate Yonyam Labdhe Garbhepi. So Rakta Pitta Kara Nidana could not be traced as such. Maybe some factors are hidden. Prior to pregnancy, there may be some indulgence factors. So that we could not rule out, or maybe because of climatic or environmental variation. So we ultimately went with the treatment for Pitta Shaka Chikitsa and Rakta Stambhana, or whatever we can say, Rakta Prasadana, like a Panchavalkala we adopted as a Kshirataka. And the some of the grutas which are indicated in Paitika conditions like Dadimati gruta was orally administered initially, and the Pichudharana was also done, by which the end of 1 month she completely recovered from the subchorion bleed. And even Drakshadi Kashaya, which is mentioned in Rakta Pitta, Jwarottara Rakta Pitta. So Jwara is not only the manifestation of Sharira Santapa, it may be Manas Santapi also. So Sharira, Indriya, Manas. So all the three we have to consider. So Vaichityam Aratir Glanir Manasas Tapa Lakshanam has been told. So Vaichityata and Aratihi. So and Glani of the Manas, it will be the manifestation which was found in this condition also. So we adopted the Drakshadi Kashaya, which is mentioned as Jati Kusuma Vasitaha. So Draksha Madhuka Madhuka Yoga. So that yoga was administered and she completely recovered. And one more tablet which was given along with this was Kamaduga Vikta Mukta. So this contains Gairika and Amalaki. So that is the composition and Mukta. So early miscarriage also has to be considered in this other factors of infertility. Then basic evaluation of an infertile couple before undergoing any specific treatment is history and examination, which completes half of the Nidana Parivarjana. So history taking and examination will rule out half part of the Nidanika aspects, which we can avoid the hetus. Then husband semen analysis, test for ovulation, test for tubal patency, TVS or TAS, and hematological, biochemical, and hormonal evaluation, like in thyroid dysfunction, prolactinemias, all those, the LH hike, or so these things are to be taken care of well, and hyperandrogenism has to be ruled out in case of PCOD patients with PCOS or hirsutism, and hyperinsulinemia may also be to be ruled out, and the evaluation for obesity related problems in case of female are also to be kept in mind while considering the basic evaluation. And all the baseline values like a trans-abdominal or transvaginal sonography has to be done at the base level, at the day 2 or day 3, and followed by day 5 observation, followed by ovulation follicular study. Then despite all these laboratorical as well as biochemical or that of radiological investigations, we have to keep in mind that we have to know the clinical diagnosis. So first and foremost, the Lakshanika Chikitsa also will help many a time. So clinical diagnosis and what are the feelings of the patient, what is the psychological role So Saumanasyam is adopted. So by how Saumanasya can be adopted? The work which we do is to be enjoyable. Suppose the woman is doing a household activity which she is not enjoying. So we have seen patients, we come across patients who gets the MSS gravidarum once she is in her husband's home. Once she visits her own home, that is her parents' home, her MSS gravidarum disappears completely. So this is what is the difference of psychology in symptoms of pregnancy, as well as exacerbations and remissions of some of the symptoms of any disease. For example, the environmental factors as well as the role of psychology. The Saumanasyam is not enjoying the work which we are doing is also a Saumanasyakara. So it is not overburdening job. It is the non-overburdening job also maybe a Saumanasyakara. So this factor has to be elicited in the patient's psychological level before attempting any medical intervention. Then Manashalya Hara. So Harshana is said to be the Manashalya Hara by Acharya Sushruta, which we have to keep in mind. We have to keep that is by the Upacharaha Priyahitaihi Bhartra Bhrutkeshta Garbhadra. Garbhadharana and continuation of pregnancy is because of Upacharaha Priya Hitaihi. Priya and which is Hita. Both are to be adopted by Bharta and the Bhrutya, those who are accompanying people. The history of proper prior infertility and or fertility, presence of obvious risk factors, and age of woman which predisposes her for high risk pregnancy, that is beyond 35 years of age. All these factors are to be evaluated. Age at menarche and the present age has to be noted. Irregularity of delay in ovulation, then we have to correct the regularity of the menstrual cycle, and this is possible only by rasarakta vishodhana. So hormonal imbalance, if we take one drug for hormones, one drug for ovulation, one drug for artava shuddhi, so the patient will end up in asking how many drugs I have to take. I have to remember only taking drugs. So instead of that, we got, for example, an ahara made into an aushadha like tila and guda. So tila guda, when added with one of the drug like trikatu, or added with one more drug like sukumara grita, or some of the other grita yoga or taila yoga, may be beneficial for the patient. Preparation of a drug in the form of the lashuna, so which is an ahara kalpana. So we have dwadasha ahara pravicharnas. So whenever we have these modalities, and ahara vargas are also 12 in number. We have mudga, we have mulaka, we have masha. So we have lot many other materials which are the rasarakta vishodhana in nature. So whatever is mentioned for shukra shodhana and shukra janana, and whatever is mentioned for stanya shodhana and stanya janana, so those shodhana kanadravyas like shukra shodhana and stanya shodhana, these can be also be adopted because almost all are tikta rasa and agni deepaka in nature. Then the other rasayana aushadis, or these three rasayana aushadis which are agneya in nature, can also be adopted in the dietary mode. Then dyspareunia, that means the primary line of treatment need not be a drug. Primary general management principle of infertility can be balanced nutrition. So that also has to be. So dietetics has a major role in reversal of the psychological factors as well as nutritional deficiency disorders like a rasakshaya or pandutva is one of the factor for infertility. Many a times, even though we are advancing towards next century, we are failing. The national programs are not reaching the grassroots level to prevent the anemic disorders, which is the cause factor for many of the gynecological and obstetrical ailments. Then dyspareunia, endometriosis, pelvic inflammatory disease, and pelvic pain. All these things should be kept in mind while treating a patient with infertility. Many a times endometriosis patient come with is diagnosed when the patient comes for infertility or subfertility. Then PID, genital tuberculosis, thyroid disorders, galactoria. So any pelvic mass lesion which is not responding to the treatment for 3 months, genital tubercular infection should be ruled out. Then a poor endometrium also should be non-responsive. Poor endometrium should also be ruled out for genital tuberculosis history. Then thyroid disorders, galactoria, obesity, smoking, alcohol intake, any chronic illnesses, any past surgery, occupation, sexual dysfunction, sexually transmitted diseases, all these things are to be evaluated, and their treatment modalities will also be included in the treatment modality for infertility. Then examination of vaginal canal and cervix. So many a times when we ask the patients with 6 years, 8 years, 10 years, 16 years of infertility, they say we had consultations when we had 6 years of infertility. They came to us after 10 years of infertility. When they were in 6 years of infertility, they approached a non-gynecologist, and they say that in their area that non-gynecologist had a roaring practice of fertility treatment, and so we approached them. They will never do a first speculum or vaginal examination, which is a prerequisite nowadays to anatomically know, because a person who is not doing that may not be understand the anatomical variation which is mentioned in the ultrasonography report. So that is also a possibility. Then uterus in size, position, pinhole, cervix of the pinhole loss of the cervix, adnexal masses or tenderness, anteverted fixed or retroverted uterus, pelvic adhesion, PID, genital tuberculosis. So this is repeatedly coming. Then coming to the chikitsa proper, which is the scope of today, we are entering as Shodhana after Snehana and Svedana, followed by Brahmacharya Paripalana for a month duration, followed by Pumsavana Nasya and Nasaya Asyenava Pitam. So oral as well as nasal. Then Pumsavana Karaka Gritas like Palasarpi, which is a combo for all the family. That is, Pati can take, Patni can take, and the coming child Garbha is also protected by the Pumsavana Dravyas like Palasarpi. And one more Pumsavana Dravya which is very effective and safe for conception and assures the conception and continuation of pregnancy is Lakshmana Grita. Difficult to manufacture, we have to prepare it ourselves and administer. Then Mahakalyana Grita is available. Sukumara Grita is also available. Gadimati Grita is also available. Whenever we are modifying these formulations according to the Prakarana, Panduroga Chikitsa, Gulma Chikitsa, fertility conditions, or Mahakalyana Grita or Mahapaishachika Grita according to Manasika Rogas, etc. So we can modify them along with adding the Hema Basma or Hiranya Basma or Suvarna Basma. So that is also highly beneficial in imparting Hemah Sarva Garanyashu, Visham cha Viniyachati. So whenever we are non-compatibility food items, so Viruddham Annam Pravadanti Hetum, Santana Doshasya cha Vadanti Hetum. So Santana Dosha Hetu is said to be Viruddham Annam Pravadanti Hetum by Acharya Charaka, while he is concluding remark on Viruddha. After mentioning all the Viruddhas, he is concluding that one sloka, he is concluding that Santana doshasya cha vadanti hetum viruddhamannam. So this concept of visha, gara visha has also been addressed in case of treatment of infertility. Then Purusha, for Purusha, Madhura Ushada Samskrita Grita and Kshira, for Stri, Taila and Mashotarahara, and here only Taila and Masha or Masha Siddha Vada etc. is not only the treatment modality. We can modify the Masha, Taila or any of the Agneya Dravya which is Ushna and Snigdha. So that is the intention, which may be Guru or which may be Laghu. According to the Agnivala, Guru Laghavata can be administered in the patient, and we can always advise Gavya, that is Go Kshira, Go Ghrita, etc. But at the same time, Mahisha Kshira or Ajakshira may also be employed in some conditions. Then, for example, the patient had the history of genital tuberculosis or tuberculosis of any of the other system, we can go with Ajakshira. Then the infertile woman should be prescribed with Vamana, that is in case of thyroid dysfunctions, in case of Urdu Jatrugata Vikaras, obesity and Kapha Bhuishta Koshta in the Urdu Amashaya. So in such conditions only we go with the Vamana. Or else we can advise a seasonal Vamana, that is Vasantikam Vamana, Vasantikam Doshachayam has to be removed. Then the Vairechanika Chikitsa or Virechana Chikitsa. So Urdhvam Adham Dosha Virechana Ubhayam Va Mala Virechana Virechana Mithyahu. So Vamana and Virechana may be Vamana or Virechana. So Pitta Bhurisha Koshta and Kapalpata in the Koshta should be assured before giving Virechana. Virechana principle should be followed as Ruksha Virechana or Snigdha Virechana while taking up Virechana in case of infertility patient. If she is Snigdha Gatra, Ruksha Virechana may be advised as in Avipatti Churna, not Avipatti Kara Churna, but Avipatti Churna. Prashastha Roginam, it is mentioned in Ashtanga Hridaya, whereas the Snigdha Virechana like Eranda Mula or Eranda Taila, Sukumara Eranda Taila, or Gandharva Hastadi Eranda Taila, or Kevala Eranda Taila, or Ishat Snigdha, Ishat Ruksha. For example, we can consider it is not Nati Snigdha, Nati Ruksha, which is Trivritta Valeha or which is Sarvasatmi. Then the Mrudu Vireshika Dravyas like Draksha or Draksha Mridita Jala, etc., can also be used in some cases. Kshirayanapi Virechate has been mentioned. Some people like especially Pitta Prakriti and Mrudu Koshti. The Koshta Bala should also be checked before administering Vamanadi Karma. Then Atiyoga, Ayoga, Hina Yoga, Mithya Yoga should also be avoided because Dhatukshaya, which is happening due to the Virechana or Vamana, may also hinder the treatment of infertility. Then other Karshana Dravya Prayoga, as in if we are giving the Granthi Hara Chikitsa or Buddha Hara Chikitsa, we will be administering Karshana Chikitsa. So Ati Karshana will lead to Dosha Prakopa or Vatikriti and Dhatukshaya. So even Nityananda Rasa or some of the other Rasa Yogas which we are giving, they are not congenial for conception. Or some Gugula Kalpas, if we are administering continuously over a period of 3 months, it is not congenial. Then Astapana Basti and the Niruha and Dosha Stapana and Niruha and Anuvasana is also said to be beneficial. Virechana is said to be Akaramanya Bija, it is best treatment. Then Alpa Pushpa, Nashta Pushpa and Nashta Bija, Anuvasana is indicated as per Kashyapacharya. And Yapana Basti is most commonly practiced in case of infertility for in Yoga Basti module or even in Karma Basti module. So Kala Basti module nowadays very seldom people are affording to the longer duration of stay. Then some of the formulations, though formulations are ananta, and we need not have a look into it because according to the patient's requirement, we have to select the drug. Nagakesara with Trikatu may work in one person, Chitraka may work in one person, whereas the same may produce a hemorrhagic cyst if we administer it in another person. So hemorrhagic cyst, the bleeding into the cavity should not happen in case of a maturing follicle. So we should not advise too much tikshna aushadas or pittala dravyas in case of ovulatory period or in the ovulatory window. Then Lashana Prayoga, Tila, Shigru, Guduchi, Gomutra Haritaki, etc. are beneficial. And Ashokarishta is invariably beneficial. Then polycystic ovarian disorder, we can administer for ovulation, Lata, Gharanja, Varuna, etc. Then Arogya Vardhini is also found to be beneficial. Premature ovarian failure, and if we are coming across the low AMH levels like symptoms, repeated Shodhanottara Shamana and Matra Basti, though if your patient is not going with the Shodhana Basti, we can go with the Matra Basti with various dravyas like Pipalyadi Taila was one of the study drug in my condition of doctoral studies at Jamnagar. So where the drugs were highly beneficial. The Prakarana is told for Arshas, but the treatment was found to be beneficial in Mudavata Anulomana concept. So it was found to be highly beneficial in PCOS patients also. So Matra Basti is highly beneficial. Maybe Dashamula Taila can also be administered. Shatapashpa Taila can also be administered according to the Doshabala, or various other Mahanarayana Taila which contains Shatavari as a main ingredient can also be used. So Taila Basti and Taila Uttara Basti are more preferred than Grita preparations being administered in case of women. Then blocked fallopian tubes, we have a lot of Uttarvasi dravyas have been scientifically evidence-based proved at Jamnagar. That is Kumari Taila, Yavakshara Taila, Tila Taila, Sukumara Grita, etc. Then single drugs are also there. Then cervical mucosal hostility, we can go with Guduchi Adi Kashaya Pana, Guduchi, then immunomodulatory effect also we will get. Then Triphala Kashaya Prakshalana is also found to be beneficial, and we can add even Tankana Basma to that, or we can add some of the other formulations to that so that the cervical mucosal hostility or cervical mucosal problems can be avoided. Then Pichu Dharana as well as oral intake of Kshiri Vraksha Kashaya and Haridra Churna Prakshalana, for example, Avachurana as well as Prakshalana, St. Madhu Kashaya or St. Madhu Ghanavati. So I have come across St. Madhu Ghanavati, though not in fertility seeking patient, it is highly found to be effective when administered in case of diabetes mellitus and pregnant patient with the PID. This chronic cervicitis could be treated only by administering St. Madhu Ghanavati. So that was one of the finding. Then Dadima Digrata is Dukha Prasavinina Mandyanam Prashasyate. So in case of Rasakshaya Lakshanas, Dadima Digrata can be administered pre-conception and also post-conception. Then Phalasarpi, Masanamasika Kshirapakas. So Madhukam Shakabijam Cha Payasya Suradarucha. That combination, Artha Shloka Samapanaha Saptaitan, Saptamasena. So that combination like Rasapachaka, Raktapachaka, we are giving in Maharashtra practice. Similarly, we can give Masanamasika Kshirapaka. Individual drugs can be selected and prepared, or Ghanavati can be prepared and administered. So whatever is the ease of administration, we can practice as Kshirapakas. Then underweight woman, because of the Vata Pitta dominance condition, Kashmarya Kutaja Siddha Grita is mentioned in classics, but we can give the Phalagrita, Kalyanaka Grita also. So Vatam Hatva Garbham Dadati. So that is the reference there. So Vata Pittabhyam Kshiyate Rajaha is the reference for the dosha. And Ashta Shukra Dushti, Ashta Ardhava Dushti should also be corrected parallelly by our treatment modalities. So Shodhana as well as Shamana is indicated. For various formulations are mentioned like Shatapushpa Narayana, then Phalasarpi, Kalyanaka Grita, Kalyanaka Guda for Nitya Virechana. So Nitya Virechana is another concept in case of infertility where we can give the Mani Bhadra Guda or granules of Mani Bhadra, Kalyanaka Guda, etc. For various form infertility, Kalyanaka Guda is found to be highly beneficial. Then Panchakarma therapies like Udvartanam, then Shirodhara, according to the condition like Kafamedo Vilayanam is required, then Vyayama followed by or Udvartana followed by Vyayama is indicated. Shirodhara in case of psychological factors or we want to achieve a better Saumanasya, Shirodhara can also be adopted because it is one among the Murdhi Taila. So Abhyanga Seka Pichavaha Bastischeti Chaturvidham is being mentioned for Murti Taila. Shirodhara is one of the way we are doing. It may be Ruksha as well as it may be Snigdha. Basing if it is Takradhara, it may be imparting more Raukshyata, whereas Kapha Bhuishta Urdhvanga, Takradhara may be beneficial. Tailadhara or Jaladhara may be better in case of Vata Shleshma. Then in Shleshma Bhuishtata, though we are not doing any Shirodhara acute conditions, we will be going with the Nasya, Shodhananga Bhuta Nasya. Then Abhyanga and Marma therapy, various Marma therapies are also indicated for fertility promotion. Then Vamana, Virechana, Nasya, Basti, Matra Basti, Uttara Basti are some of the general principles of treatment according to the Dosha Vasta. According to the Samprapti Ghatakas of that particular infertility patient, we have to break the Samprapti. Then rejuvenating therapies, massaging the body reduces the stress. Foot massage is also found to be highly beneficial. Then rejuvenates the entire body and pacifies the underlying doshas. So this is one of the publication for evidence-based practice, Ayurvedic management of endometrial factor of infertility, a case report done under my observation by a scholar. We could establish it through Applebaum criteria. The achievement of endometrial thickness, you can very well appreciate, I think, if I'm not wrong. The Applebaum's uterine scoring system for reproduction, USSR criteria, we say. Then the endometrial blood flow in the zone 3 was modified to 5 when compared to that of 0 or 2 earlier to the treatment modality. And myometrial blood flow was absent, it reached the grade 2, and total score from 10 to 19 we could achieve, and the patient could conceive subsequently. The endometrial layering was also to be trilaminar, or it can be penta also, that is distinct 5 line can be also observed. So we can, I think you can appreciate here the variation in the endometrial thickness. This is the color Doppler study where increased blood flow. So one of the drug which I used in spontaneously patient conceived after 1.5 months of kashayapana, that is Punannavashtaka. Punannava, Nimba, Patola, Shunti, Tikta, Amrita, Darvi, Abhaya Kashaya. So though it is indicated in Sarvanga Shota, Jwara, Kasa, Shula, Shwasa, Nitam, Pandugadam Nihanti, it is a wonder drug in case of many of the disorders. It corrected the anemia, at the same time Niramikarana happened, and blood flow to the reproductive system increased after administration of Punannavashtaka, which was evidenced during my doctoral study. I had done a before and after, but I did not procure the pictures at that time. So color Doppler velocimetry showed a rapid improvement in the blood circulation to the genital organs. So there are some oral drugs which we administered. They do the rasa prasadana, vatanulomana, apana vatanulomana, thus leading to that is sneha yukta kashaya pana. Some of the krutapanas or the kashayas along with the sneha dravyas, when they are administered, they enhance the blood circulation to that of pelvic organs. So this is one such publication. And research scopes and assessment parameters, if we think, we have lot of research fields to improvise in infertility management, like role of Ayurveda in improving Garbha Sambhava Samagris one by one, and role of Ayurveda in lifestyle disorders like PCOS and Asrugdara. So Asrugdara can also be one of the causative factor for infertility. Then role of Ayurveda in immunological disorders leading to infertility, management of preconceptional anemia and its correction through Ayurveda and preventing infertility, nutritional deficiency disorders, prevention of infertility, Masanumasika Srava Shulahara Yoga, when adopted prior to conception and after conception, can also be beneficial. Then Masanumasika in preventing the Garbhasravi Vandhyatva. Then Masanumasika Ahara Vihara Paricharya in recurrent pregnancy losses or in healthy pregnancy. Then management of IUGR, Prameha Divikara in Garbhavastha. For example, IUGR had mentioned earlier in one presentation that the role of Ayurveda in polyhydramnios and oligohydramnios is equally proven. Though in very acute condition, sharp rising amniotic fluid polyhydramnios, we are unsuccessful. But if it is a gradual process over a period of 28 weeks, 25 plus weeks, up to 30 to 34, 36 weeks, we can treat and manage to, we may help the pregnancy to progress up to 37 week of gestation. Then prameha, the vikaras in sagarbhavastha can also be to be managed. So one problem in hindrance in prameha, the vikara chikitsa is a patient who is a known diabetic then conceives. So what Ayurvedic interventions can be done to prevent the miscarriages has to be monitored. Though the line of treatment, standard line of treatment is injections or insulin injections, we have to give some Ayurvedic dietetics which can augment the process of normal production or maintenance of pregnancy. Then color Doppler velocimetry indices can be an assessment parameter. Then Applebaum criteria for endometrial factors of infertility. Shuddha Shukra and Shuddhartava assessment criteria should be framed and which can be adopted for infertility treatment. So to conclude, without taking much time, as per Ayurveda, the woman who is not able to conceive is called as infertile. It also includes inability to conceive after having previous history of conception. Different acharyas have stated different types of infertility based on which we can correlate them and with the types of infertility in the present era. Acharyas have also stated stress as a factor of infertility. So, Daiva Vipashraya, Yukti Vipashraya, and Sattva Avajaya Chikitsa also has to be done in as a treatment modality. And Daiva Vipashraya equally plays a role in treatment of infertility very well. Then Panchakarma and Rasayana plays a major role in treatment. Patya has also a supportive role and it should not be neglected because Patye Sati Gadarthasya Kimaushadhi Nishevane, Patye Asati Gadarthasya Kimaushadhi Nishevane. Then treatment includes counseling, medicinal and surgical methods based on the underlying pathology. So surgery or Shastrakarma is not excluded for fertility treatment, but we can minimize the usage of Shastrakarma by using proper Ahara Aushadha Seva. These are some of the references. Thank you, and I acknowledge Kamini Dhiman Madam, all the faculties and the organizing team of IRES, and thankful to the principal, NCT, Ayurvedic College, Amreli, Gujarat, and all the students and teachers of Ayurveda. Thank you, one and all.
Thank you, Dr. Ashokan.
बहुत बहुत
You
धन्यवाद.
have, yeah, you have covered all the aspects and all the areas of infertility to be focused in the case. And now, if anyone want to ask questions, we can take up the questions, or anyone want to add anything, any significant members, if anyone want to add, can add. So, first of all, we will take up the question, and then we will
Please
invite.
stop share, Dr. Ashokan. Please, yes. Now open session community.
जी जी बिल्कुल. Anyone want to ask something, anything? अंजना मैडम कुछ ऐड करना चाहेंगे आप? अपना कोई व्यू, अपना एक्सपीरियंस. अंजना मैडम.
जी मैम, नमस्कार मैम. बहुत सुंदर सर
नमस्कार.
अशोक. बहुत सुंदर सर का तो इतना अच्छा सा एक्सपीरियंस है, सर का इतना वास्ट एक्सपीरियंस है, सर का प्रेजेंटेशन तो फिर हम लोगों ने तो आज अपने बहुत अच्छे से ज्ञान का वर्धन किया है, बच्चों को भी बहुत फायदा मिला है. और सर के एक्सपीरियंस से मैडम आपका बहुत बहुत धन्यवाद. और सर का भी बहुत बहुत धन्यवाद कि सर ने इतना अच्छा प्लेटफॉर्म दिया हम सब लोग को जुड़ने के लिए. और अच्छा लगा, बहुत अच्छा लगा. और इसमें केवल सुनने का ही था, अभी लग रहा था सर अभी और बोले और हम लोग और सुने. ऐसा कुछ लगा नहीं मुझे कि सर ने कुछ मिस किया होगा, और सर का अनुभव भी बहुत ज्यादा है, तो अच्छा लगा मैडम. थैंक यू मैडम जी.
कुछ आप अपना
आपका
एक्सपीरियंस मैडम.
हाँ मैम, एक्सपीरियंस तो बंध्यत्व में जैसे सर ने बताया, दो तीन पॉइंट सर ने बताया. तो दो तीन पॉइंट में जैसे सबसे पहले तो सर ने बोला था कि हम लोग बहुत अच्छा कार्य करते हैं, स्पेशली जो है अगर हम ऋतु क्षेत्र अम्बु बीच पे जाते हैं, और ऋतु क्षेत्र अम्बु बीच की बात जहाँ करते हैं, जैसे स्पेशली उन्होंने बोला कि जो ट्यूबल ब्लॉक है, ट्यूबल ब्लॉक पे बहुत अच्छा कार्य हो रहा है, और रियली रिजल्ट्स बहुत अच्छे आते हैं आयुर्वेदिक ट्रीटमेंट से. क्योंकि जनरली पेशेंट हमारे पास तभी आते हैं जब वो वहां से रिफर हो जाते हैं, या फिर वो आईवीएफ के लिए कहा जाता है, तो पेशेंट हमारे पास आते हैं. तो यहाँ पे कई पेशेंट हमारे पास भी इस तरह से चल रहे हैं, और कई पेशेंट प्रेग्नेंट भी हो चुके हैं. और जो सर ने इस तरह से बताया कि हम नित्य विरेचन पे काम करते हैं, और साथ में उत्तर बस्ती का बहुत अच्छा रोल है, लेकिन कोई भी कार्य करने से पहले पूर्व कर्म का भी बहुत रोल है. तो अग्नि पर जो सर ने बताया, गृहिणी पर कार्य बताया, स्पेशली यकृत पर हम लोग अच्छा कार्य करते हैं. तो जैसे नित्य विरेचन में बहुत अच्छा पता चला कि इसमें रूक्ष विरेचन और स्निग्ध विरेचन, या फिर कुछ रूक्ष और कुछ स्नेहन, तो हम लोग जनरली इसी तरह का यूज करते हैं. और आरगवत वगैरह यूज करके, जैसे मैं अक्सर बताती हूँ, निशोथ है, मधुष्टि का रोल बहुत अच्छे से मिलता है. साथ में हमने क्या क्या है कि जो उत्तर बस्ती की बात हम कर रहे थे, तो उसमें जनरली हम सैंडविच बस्ती यूज करते हैं अपने बच्चों के साथ रियली की. जैसे हमने शतपुष्पा तेल लिया, और उसमें थोड़ा सा गोमूत्र अर्क 0.5 मिलाया, फिर हमने शतपुष्पा तेल मिलाया. उसके बाद हमने इस तरह का जो उत्तर बस्ती को यूज किया है. उससे पहले हम मात्रा बस्ती जरूर कराते हैं पेशेंट को, चाहे 2 या 3 मात्रा बस्ती के बाद ही हम अटेम्प्ट लेते हैं ऋतु काल में. और रिजल्ट्स बहुत अच्छे आते हैं. सर का ये बहुत अच्छा एक्सपीरियंस लगा. योनि बस्ती का भी मेरे को बहुत अच्छा रोल मिलता है. योनि पूरण या योनि बस्ती जिसे हम कहते हैं, उसमें थोड़ा सा कुछ पेशेंट आते हैं जिसमें उत्तर बस्ती नहीं करते हैं, तो एक अच्छा हमको वहाँ क्वांटिटी जो है वो हमें उत्तर बस्ती से ज्यादा अच्छी हम वहाँ दे पाते हैं. और हमको लगता है कि एब्जॉर्प्शन एरिया भी वहाँ बहुत अच्छा मिलता है, और मोमेंट्स में और पेशेंट की जो एंडोमेट्रियम थिकनेस में बहुत जल्दी अंतर मिलता है हमको उसमें. और प्रेगनेंसीज के जो चांसेस होते हैं वो बढ़ जाते हैं. तो बंध्यत्व तो मैडम इतना बड़ा टॉपिक है, और सर के इतने अच्छे अच्छे अनुभव हैं, और आप सभी लोग बहुत ज्यादा लर्निड हैं. कोशिश थोड़ी थोड़ी हम लोग भी करते हैं, और रिजल्ट्स भी बहुत अच्छे मिलते हैं. और नस्य चिकित्सा मेरे को बहुत अच्छी लगती है, क्योंकि मैंने उस पर काफी काम कराया है. नारायण तेल का नस्य है, विष्णु तेल का नस्य है, शतपुष्पा तेल का नस्य है. अभी भी 2-3 थीसिस चल रही हैं, और उस पर हम सीधे क्या करते हैं कि फॉलिकुलर स्टडीज देखते हैं. क्योंकि जो रिजल्ट्स आते हैं वो अच्छा लगता है कि हमें प्रूफ रिजल्ट्स मिले. तो उसमें एंडोमेट्रियम थिकनेस, जैसे हम कहते हैं कि हमारा जो है क्षेत्र भी तैयार हो रहा है, हमारा बीज भी तैयार हो रहा है, और हमारे पास हिमेटोलॉजिकल इन्वेस्टिगेशंस रहते ही हैं, जिससे हम हीमोग्लोबिन लेवल पे उसको देख सकते हैं. और फिर उसके बाद जो रिजल्ट्स आते हैं वो अच्छे आते हैं, पॉजिटिव आते हैं. तो इस तरह के एक्सपीरियंसेस हम लोग शेयर करते रहे सब लोग. और हमारे पास चांसेस ज़्यादा है, इसलिए जैसे मैडम सर ने बताया होगा कि हार्मोन्स वगैरह रियली हम लोग को नहीं देना चाहिए, क्योंकि हार्मोन्स के साइड इफेक्ट्स भी बहुत ज़्यादा है, और फिर पेशेंट को जो है कभी कभी बहुत प्रॉब्लम्स भी हो जाती हैं। तो बहुत अच्छा बताया कि दाढ़ी मास्टर घृत के की जगह हम लोग मधुरेष्टि घृत भी यूज करते हैं, दाढ़ी मास्टर घृत भी यूज करते हैं, और अपनी आयुर्वेदिक ड्रग्स शताब्दी है, तो अगर जैसे हम कॉलेज में है, बहुत पेशेंट हमारे पुअर भी आते हैं, तो हम उसका सिंपली क्षीर पाक भी बना के उसको समझाते हैं। मुनक्का के लिए सर ने बताया, मुनक्का का जल हम लोग सभी को यूज करते हैं, खजूर का पान भी हम लोग बहुत यूज करते हैं। तो इस तरह की चीजें हम कॉमनली ही पेशेंट को ज्यादा बताते हैं, मेडिसिन का भी यूज, क्योंकि गवर्नमेंट सेक्टर में बहुत कम मेडिसिन मिल पाती है। तो हम लोग भी आहार विहार पे ज्यादा कंसंट्रेट करते हैं, और यही बताते हैं जो सर ने आज बताया, और बहुत अच्छा लगा मैडम, थैंक यू मैडम। बहुत बातें हैं लेकिन फिर करेंगे, अभी तो टाइम
जी
ज्यादा हो
जी
चुका है जी मैम।
जी, थैंक यू मैडम, थैंक यू सो मच। एनीवन एल्स वांट टू ऐड? जहाँ तक मैं देख पा रही हूँ काफी लोग जुड़े हुए हैं। सर कंक्लूड कर सकते हैं, क्वेश्चन कोई है नहीं है?
There any value addition or
BL
opinion,
BLK.
madam?
Somehow,
वैल्यू एडिशन में अभी मुझे कोई दिख नहीं रहा है जी, इसको मैं इनवाइट
मुझे
कर
बहुत
सकती हूँ
नेगेटिविटी फील
मतलब
होती है
अभी।
being in with
मैडम विद्या बल्लाल मैडम है।
आज रामवीर भाई जी भी नहीं, रामवीर है नहीं है।
विद्या विद्या बल्लाल मैडम है मीटिंग में।
for telecom. I think I
Ashoka ji,
डॉक्टर
would you
विद्या,
like to add anything?
some robotics.
नहीं मैडम, नहीं सर, अभी कोई मंथन करने वाले हैं, जैसे कि विद्या बल्लाल मैडम प्रोफेसर हैं, तो
Welcome,
उनसे
welcome, welcome.
अगर
We
अनुरोध
would
है
like
कि
to
अगर वो
welcome
कुछ
Vidya ji.
मंथन ऐड करा।
Then with Vodafone.
Please call.
Aircel.
Yes, brainstorming can be done definitely.
Gujarat.
Ayurveda is Samudra Manthan.
No, which circle? Vodafone.
Kamini ji.
जी डॉक्टर विद्या नहीं सुन पा रही हैं
Yes,
विद्या।
madam. Yes, madam.
हाँ,
Tell me,
we
madam.
want to listen your experience, some 2-3 cases if you want to share.
No, I can tell about. I do not like sir. I have not gone deep into horoscope and all, sir, madam. But I have a lot number of good cases which I have succeeded. Like for example, for tubal blocks or infertility, I have succeeded with Uttar Basti. For infertility of 14 years, where they have done an IVF and failed, they had come to me. We had given only one course of Virechana, and then we had given one Basti, just Basti, because the patient complained of pain. Maybe that is, I feel that when we give one Basti, it does a Kshetra Shuddhi. As in Kerala, they practice IVF, all modern doctors who do IVF, they send a patient to the Ayurvedic doctor for a Kshetra Shuddhi by Basti, and then they ask them to come, so that the rate of success rate of IVF is much more there. This is how they do that. They do practice. I have heard about that. And I do the same thing. I do somehow, I do not know this 14-year-old lady also who had married and failed IVF. She conceived after I gave one basti. So there is
Yeah.
something like, I believe that Ayurveda has got a lot to do with infertility. It can treat a lot number of infertility. Only thing is we have to go deep into but I don't go as deep as Ashokan sir. He is just even collaborate with horoscopes and all. I don't do that much, but I go deep into my sense to know what exactly is the cause for and how I can correct them.
Yeah.
Hope I have made myself clear, madam.
Yes. This is Kshetra, Apana Kshetra, Apana Kshetra can be controlled by Basti.
Bastis.
Yes. Agnihotri sir, we can go for concluding remarks from your side.
Thank you, ma'am. Thank you. Actually, unfortunately, I'm sorry I could not join on time as I was busy with some pre-scheduled up to 9. But when I joined, Professor Ashokan was in full thing presenting his presentation. And what I found that a person of professor status and having a such long experience, the contents of the speech automatically becomes much more important. So it's very difficult to find a place to put question or to add on something. But when he was talking about the usefulness of all our panchkarmas remedies, especially as we were talking about the basti karma, definitely I feel that when the patient fails to get any remedy from on other contemporary processes, even up to IVF, they 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 are there to come to Ayurveda and consult with little their knowledge that it is Panchakarma which can do something. So after consulting the appropriate physician and our in the department, it results in a form of the output presented by Professor Ashokanji. So no doubt you are also doing the same at II Ayya there in Sarita Bihar. So was the case of all the such efficient our lady doctors of Ayurvedic discipline. They are doing very well. As you told just now that it is the Apai hit where Bhakti does. It's a wonderful result. So the hopes are always alive for such cases, and Panchkarma is there to perform the best possible and give the pleasure to the such suffering couples and also the lady herself. So with these remarks, I think it was a complete presentation covering all the sectors. Though we are learning a lot right from the anatomy of reproductive system of male and female to this extent, now we are here to manage the female infertility with some general management. So it's a wonderful session, and I congratulate Professor Dr. Ashokanji for his best presentation. Thank you so much. And
thank you, sir. God is really great. He has delayed flight for 1.5 hours. Really great. Otherwise, I have to take the flight for in between the webinar. So thank you all. I would like to congratulate Kamini for her best coordination, as well as Dr. Ashokan also, Professor Ashokan also, for his valuable speech. Thank you, audience. At present, I am at Delhi airport, and tomorrow we will be hosting from Kolkata, and tomorrow 4 webinars are there, consecutively 4 webinars. So we will be reaching to 2720717273 webinars. Thank you very much again. Tomorrow is UP Foundation Day, Girl Quality of Girl Child Day, and then our nutraceutical series. So thank you very much. Thank you all.
Thank
Good
you.
night.
Thank you.
Good night,
Good night.
everyone.
Thank you. Thank you.
Dhanyavad. Namaskar.